Hey guys, it's Nurse Gwenny. Let's talk about a thromboelastogram. It's a lot easier to just call it a TEG for short. A TEG is a lab test that we perform on a patient's blood to look at their coagulation. Now I know what you're thinking, well, why don't we just use the INR, the PT, the PTT that we've always used? Well, those just look at how quickly the blood clots. However, the TEG looks at all aspects of the patient's coagulation, how quickly they form a clot, how strong that clot is, and then how quickly that clot breaks down. And we use this in the emergency department and transport setting? Exactly never. This is an ICU thing that fine-tunes the patient, usually like a trauma patient or any kind of bleeding patient, throughout the course of their care to determine exactly what blood product or medication that the patient needs to help them in their course of their care. Now, how a TEG works is it's kind of like measuring an earthquake and like a seismograph, okay? So my x-axis here is going to be time. My y-axis is going to be oscillations. And so what they do is they put a little bit of blood in this little bitty bowl, and then there is like a rod that measures the oscillations. And then the machine, here I'm gonna have to hold it like this, the machine moves the bowl a little bit. And see, with this water, I sloshed it around everywhere, about got it in my brownie mix. As I move the bowl, because the water isn't very strong, it's not a viscous solution. This would be early in the test. We put the blood in there and it's still liquid. When they slosh it around, it doesn't move the little joystick rod thing that they've got in there. Whereas when the blood starts to clot, I've got some brownie batter. I love brownies. And if I start to move this around, of course, look at how it's pulling that whisk because the brownie batter is much thicker and hanging onto it. Now, here's an example of a TEG, and you see it kind of looks like a wine glass. So that straight line is how long it takes the blood to form a clot, and then you see kind of that curve outward. That's more oscillations because the blood is getting thicker, and then as it thins out, that's how quickly the clot starts breaking down. So if we see in a patient they have a really nice, good maximum amplitude, so a nice strong clot, but it breaks down really quickly, that's an example of a patient who might need TXA to help their body to stop breaking down a clot so quickly. There are other parts of this that if the patient has a too wide or too narrow part of that oscillation curve, they might need cryoprecipitate. These patients might need platelets. And using the TEG helps us to refine exactly what to give the bleeding patient so that they'll quit bleeding.